Good morning. My name is Min, and today our group will assess to Aboriginal community control health services kidney disease in Aboriginal and Islander population in remote area of Napranum. So I would like to introduce Adi, Haja, and Tam. First, I will introduce Tam, who will discuss the link between culture and health of Aboriginal community in Napranum partnership. And Haja will identify and explain the social determinants of health. And finally, Adi will talk about a consideration as a student nurse how to play culturally and safe nursing practice.
The aim of this presentation is to analyze the perspectives on the links between culture and health of Aboriginal community in Napranum, remote areas located in Queensland. According to the Australia Bureau of Statistics, the population of Aboriginal and Torres Strait Islanders is 649,200 people living in Australia. The Queensland has the second largest populations of Aboriginal and Torres Strait Islanders. Populations live in is 1,806, 482 people. There are more than 100 languages and dialects that Aboriginal and Torres Strait Islanders speak in different communities. One of the 48 communities in Queensland, the Aboriginal and Torres Strait Islanders settlement is in Napranum. Napranum is a small community of Aboriginal and Torres Strait Islanders that are located in the west coast of Cape York in remote far north Queensland, which is 9 kilometres south of Whippia. The population's 1,001 people in 2016, and also since the arrival of the European colonization, formerly known as Whippia South, estimated in 1998 by Moravana missionary on behalf of Presbyterian missions. On 30th of March 1985, the Whippia South communities elected 5 councillors to constitute Whippia South Aboriginal Council. An Aboriginal reserve held by the Queensland Government was transferred to the Council on the 27th of October 1988 under a deed of grant in trust, which is a DOGIT. In 1990, the Whipia South communities became known as Nepranium, which translates as meeting place of people. In January the 1st, 2005, the Nepranium Aboriginal Council became the Nepranium Aboriginal Shire Council. Nepranium's Cape York Health Council partnership with Nepranium's community began providing services in 2010. Chronic disease services and building up a few comprehensive primary healthcare services, including doctors, nurses, and allied health services. So in August 2016, Primary Healthcare Centre was established in Nepranium as part of the APIMIA. Is a community-controlled health services offered a full range of culturally appropriate on improving and maintaining the health and well-being of the Aboriginal and Torres Strait Islanders. The Nepranium Primary Healthcare offers multidisciplinary and whole primary health and acute care services through strong partnerships between nursing staffs, Aboriginal and Torres Strait Islanders, health workers. Nepranium services include acute medical and surgical, aged care, adolescent health, child and marital health, chronic disease management, and also diabetes. Links between cultural and health of Aboriginal and Torres Strait.
Access to Aboriginal Community Control Health Services. Aboriginal Community Control Health Services, ACCHS, are culturally appropriate primary health care providers that are planned and governed by the elected Aboriginal Board of Directors. They are not government-run, and at the national level, their role includes representing and advocating for constituent Aboriginal communities in matters related to health services, health research, and health programs, developing, promoting, increasing, and expanding the provision of quality healthcare through the local ACCHS, a 60-member organization in regard to health services in communities, assessing the health needs in Aboriginal communities and take steps to meet the needs, liaising with the government, with Aboriginal and non-Aboriginal communities on matters relating to Aboriginal communities' well-being. Most of the Aboriginal communities do not meet their primary health care needs, and many ACCHS are not available. With the Nepranium Aboriginal community, the State Aboriginal Community Control Health Services is Queensland Aboriginal and Islander Health Forum. Access to Aboriginal Community Control Health Services refer to planning, increasing, and involvement of the government in terms of association with the ACCHS to help the Aboriginal to gain a better health well-being. By accessing to Aboriginal Community Control Health Services, the certain goals can be achieved. Assess the improvement for the Aboriginal community. Local community has ownership and control of the health services, and giving our services is responsive and flexible. Primary healthcare improve. Availability of primary healthcare services is varied in one place, which creates the integrated and holistic rather than being built different specialists. Culturally appropriate can cater for the social cultural needs in care provision. The organization primarily run by the Aboriginal people, and the non-Aboriginal needs to be aware and educated about Aboriginal to deliver care in the most appropriate way to avoid sensitive and misunderstanding. Presentive, a major source of education, training, and achievement for Aboriginal people. By delivering healthcare, the doctors and nurses can provide to the patient more understanding on their health issues, the process of improving, as well as a certain knowledge to avoid it to happen in the future. Community control in health builds Aboriginal community capacity and social capitals. Provision of relevant training and culturally appropriate information for the non-Aboriginal community. The non-Aboriginal employees will have the chance to be provided their suitable knowledge for taking care of the Aboriginal patient, including culture and communication. Decrease the gap between Aboriginal and non-Aboriginal communities. By giving the non-Aboriginal the close relationship between two different communities can establish, and therefore the goal of closing the gap is closer to be achieved. Ways to achieve the goal. First, access to primary health care funding and medical benefit schedule. Commonwealth Government expenditure on Aboriginal health is not high, 63 cents per head on Aboriginal and Torres Strait Islander people compared to $1 with other Australians. This contributes to poor health status, lack of meaningful access to primary health care, leads to higher dependence by Aboriginal people on hospital-based care, and result in failed prevention and immediate burden of disease. The risk is high, benefit from intervention will be greater. For example, screening 20,000 people with a low risk for renal disease will prevent one case of in-stage renal failure, but the same screening applied to high-risk Aboriginal clients could prevent at least 40 cases of in-case renal failure. Therefore, the considerable reduction in the cost will be established. Second, access to medication. Through NACCHO involvement in Australian Pharmaceutical Advisory Council, government and a range of peak health and consumer bodies have been working to address the problem of accessing medicine. By November 1993, 37 ACCHS serving a combined population of 58,000 people have been approved for this section of 100 supply medication. This can provide an Aboriginal community the opportunity to build a local partnership between health services and community pharmacy in quality use of medicine. Third way is you assess the healthcare staff. GP and nurses involvement would bring a huge impact on improving healthcare in Aboriginal community, especially in remote areas. With the overall knowledge in healthcare facility and also to meet the standard needs in Aboriginal community, as a certain amount of doctors and nurses is vital, especially nurses because they are the one contact the most to the patient. This recruitment is open for Aboriginal and non-Aboriginal people. This not only provides the healthcare needed, but also helping closing the gap between the Aboriginal and non-Aboriginal people.
Kidney diseases in Aboriginal communities in Neparanim. Kidney diseases is significant health issues in Aboriginal communities, especially live in remote areas. Factors that contribute to the phenomenon includes poor nutrition, poverty, and lack of employment, lack of education. In 2014, the new Island and Cape store has been opened in Queensland. The main project in Neparanim community programs, Better Health, aim to encouraging healthy lifestyle changes such as making healthy food choices and doing more physical activities. Links between cultural and Aboriginal.
With 4 elements, which is natural, environment, direct, supernatural, and
Links between cultural and Aboriginal and Torres Strait Islander health in Neparanim. Neparanim community celebrates National Aboriginal and Torres Strait Islanders Day observation commits as the NAIDOC commitment of the deed of granting the trust of DOGIT on October 28, 1988. The theme was We All Stand and Sacrifice, Ground Learn, Respect and Celebrate in 2015. The Marianne Coconut Library was officially opened on the 28th of October 2015. The community will welcome the Konjundi Mala Cookie Dancer, Aboriginal and Torres Strait Islander history, culture and achievements, opportunity to recognize the contribution Indigenous Australians make to our country and society. Neparanim's Aboriginal community turns disadvantage into opportunities, as the ABC News stated in 2014. In 2011, the Neparanim community partnership with the Mystic Exchange to help develop and implement the community-owned visionary plan for 10 years. Annalise Jennings is a director, whole of the community change program, achieved within 3 years. There was 80% decrease in adult domestic violence, 60% increase in employment, 80% reduction in children attending the safe house, 50% decrease in adults' court appearances, community-owned housing and constructions, open-owned community supermarket, renovated community hall and sport ovals, war memorial and town signal, estimated daycare center and refurbished preschools, restaurants and takeaways.
The Aboriginal and Torres Strait Islander people has gone through many challenges owing to their semi-nomadic lifestyle. As a result, they have lower health standards compared to non-Indigenous people in Australia. Amongst the social determinants of health, including aspects such as employment, discrimination, education, infrastructure, and history, it is noteworthy that most healthcare services in Australia are not user-friendly to the Aboriginal and Torres Strait Islander people, which put them at a disadvantage. For instance, some of these healthcare services are not culturally appropriate. Thus, some Aboriginal and Torres Strait Islander people fail to access these services. Further, the Aboriginal and Torres Strait Islander people live in remote areas, which is challenging for them to access healthcare services in a good time. The availability of healthcare services in a particular place affects the overall health status of the population. Some Aboriginal and Torres Strait Islander people communities live in areas where it is difficult to access hospitals, education institutes, or reliable transport systems. This paper will examine the health status of Aboriginal and Torres Strait Islander people in Australia by focusing on the Napurna people in Queensland and kidney disease, which is a significant health issue. Aboriginal and Torres Strait Islander people are likely to die at a young age compared to non-Indigenous people in Australia. Kidney problem is a significant health issue among many Australians. However, the Aboriginal and Torres Strait Islander people are more likely to develop chronic kidney disease compared to non-Indigenous people. In 2013, it is estimated that in 5 Aboriginal and Torres Strait Islander people developed chronic kidney disease. Statistics show that the Aboriginal and Torres Strait Islander people are 3 times likely to develop stage 1 chronic kidney disease and are 4 times likely to develop stage 4 and 5 chronic kidney disease. Factors that contribute to the phenomenon includes poor nutrition, poverty, lack of employment. Historical factors also contribute to these statistics. For instance, the Aboriginal and Torres Strait Islander people live in remote areas whereby it is challenging to deliver essential services, such as areas lack adequate health centers with necessary facilities, thus contributing to the high case of chronic kidney diseases. Further, lack of education centers also play a role in the poor lifestyle adopted by the Aboriginal and Torres Strait Islander people, which also contributes to kidney disease. New Island and Cape Star has been opened in Queensland.
Cultural competent and safe nursing and midwifery practices. Having a hard yarn in Aboriginal community in Nepranum, Health Info for Net 2016, partnership with Pernimium, Cape York Health Council, Health Promotions Baby One program to support pregnant mums and dads. There were also sexually transmitted infections, which is the STIs, smoking in pregnancy, alcohol, domestic violence. Doctors and nurses should be aware when providing health services to the Aboriginal patients. Excellent interpersonal skills with understanding about the Aboriginal health, cultural and history. Be able to provide high quality of care within a culturally appropriate framework. Work in team environment with diverse of Aboriginal and non-Aboriginals. Conclusion. So the Nepranum community is one of the remote areas of the Aboriginal communities which has the low health care provided. Nurses and healthcare staffs need to be aware and understand about the cultural sensitivity and difference in the communications and the way of living between the 2 different cultures to provide the best quality of care overall. Following the code of conduct and code of ethics for the nurses. Thank you so much for listening. That's our PowerPoint for today, and I hope all of you have learned something.